Good afternoon, everyone, and welcome to the MUSC Sustainability Conversation Cafe for the month of July. Our topic today is extreme heat and health, and as you all know, that is particularly uh, in the news topic right now with all of the heat going on in the West and the Northwest where it shouldn't be. So we are going to look at that today and learn more about it and hopefully learn how to take care of ourselves. Next. All right, so sustainability at MUSC, our mission is to build healthy communities by inspiring and implementing solutions to environmental, social, and economic challenges. And our initiatives are broad. They range from topics that cover food, energy and water, green building, and the climate, and others.
Hi, everyone. My name is Rachel. I'm the intern with MUSC Sustainability. We have a monthly newsletter. If you'd like to sign up for it, you can learn about events like this. We just send it out once a month. And then we're also on social media as MUSC Go Green on Facebook, Twitter, Instagram, and YouTube. And for those who are with MUSC, we also are on Yammer as Broadcast Sustainability. Just looking into the future, we do these events every month. So next month, tentatively on August 11th, we are going to be partnering with South Carolina Health Professionals for Climate Action, and they're going to be our guest speakers for next month, so stay tuned. And like I said, you can hear more about that on our social media and in our newsletter. So for this month, our guest speakers include Charles Chip Konrad with the Southeast Regional Climate Center. Next, we'll have Jennifer Runkle. She's with Environmental Epidemiology at North Carolina State University. And then finally, we'll have Janice Barnes with Climate Adaptation Partners. So I will go ahead and pass it to Chip, and he will share his presentation.
All right. Well, thank you very much. Apologies for the delay. I'm literally down here in Charleston. And so it's my pleasure to talk a little bit about the science behind heat stress. I have a really varied background, geography, climatology, meteorology. But what I really want to do here is just kind of give you a sense about heat stress. And we're going to kind of do sort of a quick geography. Okay. But first, I'm going to just tell you all the things that go into heat stress. And we're going to look at this geography real quickly. And then, very importantly, we're going to zoom down to the local scale and basically urban environment. I'm going to tell you about some of the work we've done and a little bit about what we're going to do in Charleston. And I know Janice is going to say a lot more about that later in the presentation. And then, very quickly, I'm just going to show you our web-based heat stress prediction tool. Real quickly, just my sponsors. So I direct the NOAA-funded Southeast Regional Climate Center. You can see we do a number of different things there. A big one is educating stakeholders, such as what I'm doing now. I'm also work with, I'm part of CISA. We're also NOAA-funded. And so we really get down on the ground level and help communities out in terms of climate adaptation. So there's a number of things that we do there, and we really bring in a lot of applied science in that endeavor. So real quickly, everybody is aware of this, and we're especially aware of it this year. It seems like every year, some part of the country is getting temperatures like they've never seen before. And so we know that the climate is warming, and this is very dangerous in the summertime. And you can see here some graphics that I pulled down from Climate Central that shows some very dire scenarios there in terms of the number of days above 100. And I show you here basically the worst case scenario if we don't do anything. And it's very scary. I don't have time to go in and look at these numbers, but there's huge increases in the number of 100-degree days in basically in this region and certainly also in Charleston. Okay, heat stress. Well, we're all used to the heat index, right? We say it's not the heat, it's the humidity. The Weather Service regularly reports the heat index, and that's something we've been working with for a long time, but it turns out there's other variables that contribute as well. Wind speed, so basically a ventilation effect. So, and we've learned in our research that the faster the winds blow, the more effectively heat gets dissipated, right? So if you're hot, if you bring a fan in, that cools you off a bit. But we're in the outdoor environment, it's wind, and just small changes in wind can make a very big difference there. And then the last factor is an obvious one, is solar radiation. If you're out in the sun, it's going to feel a lot warmer. And so if you incorporate all those together, we have something called wet bulb globe temperature, and that's something that we've been doing a lot of research with. So wet bulb globe temperature effectively incorporates all four of these variables here. Okay, and I'm sorry, it looks like my screen now is locked up, so I'm not able to use my laptop here. Yeah, I can't forward it. There we go. All right. Yeah. So here just sort of shows an actual. You see there on the far right, it's an actual wet bulb globe thermometer. And this device costs over $3,000, and so it has three different thermometers on there. One's basically wrapped basically in a wet wick, and so anyway, this device is really expensive. But fortunately, we have and Kestrel manufactures several different types of wet bulb globe estimators, and they're excellent estimating. And I show you a model of one down there on the bottom right there. You can see there's a little blade there that, the faster the wind blows, the faster that goes around. So that gives just excellent estimates of wet bulb globe temperature. And wet bulb globe temperature is something that's being used a lot more today. And we see it here in South Carolina, North Carolina. The high school athletic associations now mandate that they must have a wet bulb globe thermometer, and many of them will use a Kestrel. They must have it there on the practice field. Okay, and so we have guidelines for this. And so wet bulb globe temperature, it starts to get in the danger category when we get above 80 degrees. They call it the green. It's like you get a beginning danger level, but you can see it can proceed to yellow, to red, and then the worst case scenario is black, and that's when the wet bulb globe temperature is 90 degrees or above. And so in North Carolina, these are the guidelines. And so if they measure a temperature of 90 degrees or greater, then they're required to suspend practice until the value gets below that. So fortunately, there's a lot more awareness there on that, and a lot of precautions are taken. And so they literally monitor on the field. And just wanted to show you here that OSHA has very strict guidelines around worker exposure to heat stress. And so in work environments, they're required to monitor wet bulb globe temperature. And so there's various, you can see there are various under different scenarios of easy work, moderate, and hard work, mandated work and rest periods, water intake, so forth. So anyway, that's wet bulb globe temperature, and I just wanted to show you here briefly what goes into it from a map perspective. And so this just shows average temperatures during the summer months, and you see temperature there, and you see, well, the farther south you go, generally the warmer it is. This is just an average temperature from May through September. And the second one there is dew point temperature, and dew point gives really the best measure of the amount of water vapor that's in the atmosphere. And it's a little bit hard to see, but the darkest greens occur near the coast. And so Charleston, for example, is very much in that area, and you see it down there in Florida. Basically, the closer you are to large bodies of water, the more humid it is. Okay, and so we have also solar radiation that goes into this. And this is a very interesting diagram too. And even as a climatologist, before this was put together, I wasn't sure exactly what it's going to look like, but you see variations in the amount of sunlight. And it turns out along the immediate coast in the summertime, there's a lot of sunlight. And Charleston is very interesting because if you're towards Folly Beach and you get very close to the water, it's much sunnier on a typical day than it is a little ways inland. And so that can really make a difference in terms of wet bulb globe temperature. And then the last variable there is wind speed. And so we see big variations. Some of that relate to the terrain. So the lighter colors there show where the winds are lighter and where all other factors equal, wet bulb globe temperature be higher. You see that in the mountains. Now, of course, fortunately, the mountains are much cooler, but you get less wind in the mountains because the mountains really basically slow down air circulation. Very hard to see on this map here, but if you go there to the coast, the wind speed really goes up. Okay, and we've been down here in Charleston setting up for field work, and I can really testify to that it is a lot breezier here, and so that really helps a lot. But some of you live close to the coast, if you go in a little ways, you don't have those winds, and so winds slow down quite a bit, and so we'll see some big differences in wet bulb globe temperature because of that. And so then anyway, we put all this together, and so this map here shows sort of typical values of wet bulb globe temperature. This is just the number of hours of the yellow flag, the caution flag, May through September. And you see the darkest red areas down in areas you would expect in big parts of Florida. But if you notice going up the East Coast there, you basically have a ring there that's a little bit inland that where the wet bulb globe temperatures are greater. And so focus there on Charleston or Wilmington or Savannah, going just a little bit west. You go into that area where wet bulb globe temperatures are typically greater. Okay, and so this just very similar diagram, and I'm just going to move on to the next one, but it just sort of expresses the same pattern in a slightly different way. So let's zoom in though. So this kind of shows you sort of the broad patterns of wet bulb globe temperature. If we zoom in to the local level, we've done a lot of work on high school campuses. A lot of this was right before COVID, but we've really learned a lot here too. And some of it's basic meteorology, but the surface type matters a whole lot in terms of wet bulb globe temperature. And so asphalt and concrete tends to be the hottest, so they can absorb quite a bit of radiation and then they can store that over time. And so dark colored surfaces, asphalt, can get extremely hot. And so there's a lot of infrared or long wave radiation that comes up. So you imagine walking across a parking lot. It feels a lot warmer, and and the temperature will be a bit warmer. But what you're really feeling is the infrared radiation that's basically coming off that asphalt. And we found through measurements at the high schools, there was some of them that actually had some artificial turf, and it was markedly hotter than natural grass. Okay, and then of course degree of shade matters a whole lot, and it's obvious if you're out in the sun, the wet bulb globe temperature is going to be somewhat higher. But one thing we found is that areas, let's say, that are in the sun that have been shaded hours earlier, they have a bit of a lower wet bulb globe temperature. And then going into like a forested area, say cross country trails, there obviously you're in the shade, it's cooler, but the forest floor basically has not had solar radiation. It's cool, so it's not radiating as much. So anyway, when you get down to the local scale, these things really matter in terms of wet bulb globe temperature. And then the third factor, and this relates to wind, is just how open the landscape is. And so in areas like, say, in an urban environment, you have lots of buildings, or even if you're in other areas, there's lots of trees, that really slows the winds down, and winds make a huge difference there. So those can be much more dangerous environments just because the air has a hard time circulating through these complex landscapes. Open areas are much better, and just a little bit of difference in wind speed makes a big difference. This is a bit of a complex plot. I don't have time to explain it, but it just simply shows there that if you reduce the winds from 2.5 miles an hour to 1 mile an hour, so this is just a very small decrease in wind, and you take a day, you look at the red line there, this is a sunny day, and let's assume that the temperature is 86 and the dew point is 70. So just a typical humid day, not especially hot, but just lowering the winds from 2.5 miles an hour to 1 mile an hour makes a 2 flag difference. So basically with a 2.5 mile an hour wind, you're in the yellow flag, and then take it down to 1 mile an hour, you're very much in the black flag. And so Jordan Clark is with me here, and this is a big part of his dissertation work. He's been doing a lot of field work on this, and this is really our biggest finding, that small decreases in wind speed in a basically in different environments which relate to what's around it can make a huge difference on these days that are already dangerous days with high humidity and even just relatively high temperatures. And so just wanted to give you two quick examples. So we actually visited about, I think, 7 or 8 high schools across North Carolina. This was before COVID. So this is Ashley High in Carolina Beach. So a big Google map here. And you can see there I've got the practice field identified. The big thing I want to point out with this diagram is, of course, it's the coastal plain, it's flat, and you see a lot of areas without trees. Ashley High has just a lot of green, a lot of open green space. It's also, as a crow flies, is I think less than a mile from the beach, so they get sea breezes in the afternoon. So this is not, in spite of the humidity, wet bulb globe temperature is not, it's dangerous, okay, but it's not as dangerous as some other areas. So sort of a polar opposite situation. This is Hillsborough, North Carolina, just north of Chapel Hill in the Triangle. And so this is in a hilly Piedmont location, and you see the practice field identified there, and it's down in a pit. You can't really see it from this map, but it's down at a low point in the terrain, and you've got wetlands that are on two sides of it. And when you have above normal precipitation, the water just pulls up there, and so humidities are higher. And because they're down in a pit and there's trees three ways around it, there's almost no wind at all on most days, and that makes the wet bulb globe temperature much higher. So again, that sensitivity to wind matters a whole lot, and that basically trumps geography, right? Because when you sort of average conditions out, you would expect markedly higher wet bulb globe temperatures close to the coast, but it really all gets down to the very local environment. Anyway, in a lot of ways, that can to some extent trump geography. Real quickly, we have developed a forecast tool. Forecasts makes hourly forecast of wet bulb globe temperature, and it basically takes hourly forecast from the National Weather Forecast, and we take that out to 5 days, and so we have an automated routine that does this now for the entire southeast. So we get their predictions of air temperature, humidity, pressure, wind speed, degree of cloud cover, and then we have a calculator that gives the solar azimuth angle, so the angle of the sun relative to the horizon. So it takes in all those inputs, and we have this routine that gives an excellent estimate of wet bulb globe temperature. And so basically it goes through this routine a couple times a day. And so this is an example here just of the interface. And so, and I know I'm really short on time here, but basically all the user has to do is click a location, or even better, they can put it in that little white box. And so you can zoom in on this Google map. Most people prefer the white box because they don't really know exactly where they are on the map. But you basically put that in there, you hit the submit button, and then you're presented there with a forecast. And I just happened to show one for Richmond, Virginia here. And so I'm going to blow that up here a little bit. And so here you see that this is the 5-day forecast, and the forecast is indicated by the solid black line. And it's going out 5 days, and you see the peaks there, and those correspond typically with the early afternoon hours when you expect wet bulb globe temperature to be the greatest. And so we've basically unveiled this to high school athletic trainers, coaches, athletic directors, and so more and more of them are using this. And the prior version of the tool only worked for Virginia, North Carolina, but now the tool is operational basically for the entire Southeast. There's some other features on here too. I don't have time to go into them, but you can, and I'm going to show you here. Well, I'm just showing you the guidelines here again. And I think somewhere in this presentation, I do have a link to the tool, but that's certainly something that I can provide. So anyway, so that all this has really set the stage for some field work that we're doing down here in Charleston this summer. And we really want to learn how wet bulb globe temperature varies in this exceedingly complex environment. And Charleston, as a lot of you know, there's two rivers that come together right by the ocean. So there's water that's around that definitely makes it more humid. And then you've got a very urban landscape. And to make matters even more challenging, there's a sea breeze that sets up that will cool things off just a little bit, we think. And so anyway, so we're doing the field work this summer, and so the results of that are going to get incorporated a number of ways. We're going to learn a lot more about how materials in a very local environment, how they influence wet bulb globe temperature. And there's a lot of development happening, or redevelopment happening in Charleston, and so we're hoping this work's really going to inform on the right materials to use and so forth. And I think Janice is going to say some things about it. We're also going to expand the domain of the tool to the entire eastern U.S., and we hope in the long run to have a tool that can literally zoom down almost to the micro scale. And so we're getting some very high resolution satellite imagery, and so we're hoping to develop routines so that we can really and this is probably 2 years away, where we'll have a tool that really does very effectively predict wet bulb globe temperature at a very localized scale. Okay, and then we want to expand the tool also to other sectors. Okay, so with that, I guess I'll turn it back here now.
Thank you, Chip. That was great.
Chip finished his presentation a little bit early, so we would have time for a couple of questions right now just for him. If you have any questions, just put them in the chat, like I said in the chat earlier. I do have one to get us started. So Chip, how accurate is the heat stress forecasting tool?
Yeah, so that's a really good question, and I mentioned that we want it to become more accurate. That the next version of the tool, we want to be able to really drill down to the micro scale. But from the work that we've done with the high schools, we find that it basically gives a wet bulb globe temperature reading within one flag 80% of the time, and that's going out. That's the forecast for the next day, and that's still around I think 70% going out to 5 days. So it does a very good job right now of forecasting wet bulb globe temperature, and of course we want to make that better.
Okay, great. Thank you.
Rachel, you have Sean McKay with a hand raised.
Oh, sorry. I was looking at the chat.
Yes, just wondering, is this information becoming more available to the public? Like in terms of newscasts and everything? I mean, I feel like I'm hearing more and more, as we should be, about the heat, but like this level of understanding of it, any idea?
I think it needs to come through a lot more. I mean, obviously we're hearing a lot about the heat, and there's more and more awareness of it, but we all know it's getting warmer, and it's a more complex thing, right? And I think that
Right.
most people don't understand, or they don't think about it. I mean, if they think a little bit, they say, "Oh yeah, wind speed would matter," but most people don't realize too that materials that are around you, they're radiating towards you, and these things can really make a difference, particularly in a work environment. You're an outdoor worker. What's immediately around you can have a huge influence on the kind of heat stress that you're going to feel.
Definitely. Okay. Yeah. All we could do is keep trying to spread the word. Thank you.
I guess now we will move on to Jen's presentation.
Hi, good afternoon, everyone. I am going to follow suit behind Dr. Konrad's fantastic presentation, providing a really nice overview of the science of heat stress and what are those important weather and environmental drivers, as well as this really cool new forecasting tool to talk a little bit about the public health consequences of extreme heat. I am an environmental epidemiologist, as Rachel noted, at NC State. Our institute is the North Carolina Institute for Climate Studies, and we are here in the gorgeous Blue Ridge Mountains in Asheville, North Carolina. So climate change is recognized as the leading public health threat of the 21st century, and there's a growing body of research that shows the many ways in which climate change is already impacting our health, both directly and indirectly. In the next few minutes, I really just want to unpack this statement and narrowly examine the health effects of extreme heat and explore, can we really still say that it's a leading public health threat in the context of a global pandemic? And then I'm going to pass the baton over to Dr. Janice Barnes, who's going to talk about some new heat health initiatives that are happening locally in Charleston. Next slide, please. So what do we know? Scientists have documented many indicators of a changing climate, including declines in sea ice and snow cover, melting glaciers and ice sheets, rising seas, and more intense and frequent extreme weather events such as hurricanes. And roughly 97% of climate scientists conclude that humans, we are changing the climate. Next slide. On the public health side, this is akin to what physicians and public health practitioners know, that smoking is directly linked with lung cancer. Next slide. This is just a really nice map of general climate trends across the US. It's not necessarily to scale, but as you can see, we're facing a number of climate hazards, but these observed changes in climate look differently at the local and regional scales. For example, here in the Southeast, we're particularly vulnerable to sea level rise, heat waves, hurricanes, and drought. Each trend has really important implications for health and society, but together they pose an existential threat. Next slide. This is a really nice conceptual diagram illustrating the key pathways by which climate change influences human health, kind of in the context of extreme heat. On the public health side, we understand that health is not multifactorial in nature, that there are multiple social, environmental, and institutional factors that are working at the level of the individual or a community that helps to influence humans' vulnerability to the health effects of climate change. Next slide. This is just a really nice map, really kind of similar to Chip's map, that shows trends in projected heat for the US by mid and late century. So since we began collecting data on temperature around 1895, we've observed anywhere from a 1 to 2 degree increase in temperatures across the US. And by mid-century, we expect an increase in 2 to 3 degrees, and by late century, anywhere from 2 to 4 degrees. So NOAA's dubbed 2019 as one of the hottest years on record, second only to 2016, and the world's 5 warmest years have all occurred since 2015. So we're seeing a continued trend that dates back to the 1970s, where each decade has been warmer than the previous one. And this historical warming creates a scenario for multiple and compound climate-related risk, with greater proportions of people being exposed and potentially new health risk arising, as well as risk across energy, food, and many other sectors. Next slide, please. So warming climate is expected to result in days that are warmer than today's usual temperature and lead to an increase in premature heat-related deaths. But temperature extremes, both cold and hot, can worsen chronic conditions such as diabetes, cardiovascular disease, mental health. There's been some research to suggest that hotter than average temperatures is linked to increases in suicide. And even pregnant women and their babies are impacted by hotter than average temperatures. We know that certain individuals with comorbidities, just by virtue of the medications that they take, are at increased sensitivity to heat stress. So this is by no means an exhaustive list, but just a few of the ways in which extreme heat is we're measuring the ways in which we're measuring the health effects of extreme heat. One point that's worth mentioning is that even small deviations from seasonal average temperatures in the summer is related to increases in population level morbidity and mortality. Next slide. So all Americans will be impacted by climate change, but not equally. Climate and weather patterns vary across regions, and their impacts depend on part on the vulnerability of the people affected. And we know that vulnerability incorporates place-based exposure to climate-related impacts, for example, proximity to a coastline, as well as social determinants of health, population's age, their socioeconomic status, the type of work they engage in, and even race and ethnicity. Each of these work to shape a person's sensitivity to exposures to climate and their ability to adapt. We understand that older Americans, children, people who work outdoors, persons who have chronic health conditions or who are experiencing homelessness, and those who are socially isolated and economically disadvantaged are especially vulnerable to extreme heat. Next slide. In the next couple of slides, I want to highlight a few key findings of the 2020 Lancet Countdown Report. This report represents the consensus of 35 leading academic institutions and UN agencies that make up the Lancet Countdown. One key finding is that vulnerable populations as of 2019 were exposed to an additional 475 million heatwave events globally. The rise has been driven by the combination of increasing heatwave occurrences and an aging population. You'll see in the figure the dotted line represents baseline, and this 475 million excess heatwave events compares to 160 million more person days than recorded back in 2016. Next slide. From 2000 to 2018, heat-related mortality in older people, people older than 65 years, is increased by over 50%. So much so that it reached globally a 296,000 excess deaths in 2018. And while the majority of these deaths are occurring in Eastern China, Northern India, and Central Europe, we're also seeing excess deaths here in the US and other developed countries like Japan. Next slide. So, in addition to the health consequences, we're seeing a change in labor capacity. And we know that our economic well being is closely tied to our health and well being. Another headline finding from the Lancet report shows rising temperatures were responsible for an excess of 300 billion potential work hours lost globally in 2019 compared with those lost in 2000. So, in many countries around the world, agricultural workers are disproportionately exposed. That also counts for us here in the US, as well as construction workers. Next slide. So, many of us studying the health effects of climate change have dubbed climate as a threat multiplier, by which these existing community level or individual level social and environmental stressors interact with other areas such as aging critical infrastructure, communication, and other vulnerabilities related to social determinants of health like poor housing stock, access to healthcare, and food security. And it's the combination of these social and environmental stressors working that amplify, accelerate, or worsen the health effects of an extreme weather event. Next slide. 2020 was a big year. It was a year in which we were facing multiple crises, including a pandemic, police brutality, racial justice, income inequality, and even the climate crisis. There were multiple record-setting disaster seasons. As NOAA predicted in the spring of 2020, the Atlantic hurricane season was well above average, while a dry winter combined with an unusually hot and dry summer contributed to the most active wildfire season in the West on record. As all of us experienced, the COVID-19 pandemic strained the US emergency response and health systems at all levels, revealing really critical weaknesses and exposing some long-standing systemic health inequities. And it's these weaknesses affect not only our country's ability to limit the spread of COVID, but also our resilience to climate change, both in the short and long run. The COVID pandemic is yet another reminder that those long predicted, seemingly remote and distal health risks must continuously be high priorities. The science is clear that the Earth's climate is and will continue to change, and these changes will have adverse consequences for health. Next slide. Historically, marginalized communities are disproportionately bearing the health and economic consequences of climate change. Poverty and racism have been identified as root causes. Racism in particular has cross-cutting impacts across health, education, economic, and political systems, as well as greater and health-harming exposures to everyday environmental conditions, such as the situation of pollution source located near low-income or communities of color. Climate hazards equally are also disproportionately impacting these low-income communities and communities of color. For example, these communities are often in climate hazard-prone areas like low-lying areas vulnerable to flooding, or low-income zip codes typically that lack tree canopy, resulting in more intense urban heat island and elevated exposure to extreme heat. This is one reason why two groups of Americans who care most about climate change are Latinx Americans and Black Americans. Further research led by Dr. Jeremy Hoffman, a chief scientist at the Science Museum of Virginia, his group showed that historically red-line neighborhoods are on average 2.6 degrees Celsius hotter than non-red-lined neighborhoods in the US, and sometimes the difference is as much as 7 degrees. And that is a significant difference when we think about health impacts. Next slide. Healthcare is among the most important sector in managing the effects of climate change, and simultaneously, this sector has an important role in reducing its own carbon emissions. In addition to its direct effects on human health, climate change may also produce disruptions to healthcare, social services, and these other critical life-saving systems that we rely on. This threat is particularly evident in the context of extreme climate events like a large-scale hurricane. The medical and public health community has a central role in health system adaptation and mitigation, and in understanding and maximizing the health benefits of any climate intervention, as well as communicating the need for an accelerated response. We're seeing increased engagement among around the climate crisis among this group of health and medical providers. I'm showing you here on this slide results from a 2019 survey conducted where at your home, MUSC, examining climate readiness. And we found that for those who participated in the survey, around 7 out of 10 MUSC employees strongly agree that climate change is occurring, that it's happening now. 75% of employees believe that extreme weather is more frequent, and roughly 8 out of 10 worried about the health impacts of climate change. And in fact, when asked to rank the following climate hazards from highest to lowest concern, extreme heat was ranked as a high concern among MUSC employees. Next slide. So heat waves are expected to increase in the frequency and intensity in the future, and the way local residents respond to such incidents depends on their understanding of risk, their way of life, and access to resources within their communities. To start addressing these issues, we really need to embrace the restorative justice framework guiding our work on climate change. We need to look at the most vulnerable communities, those who have been disproportionately impacted by environmental injustice, economic injustice, health inequity, and engage and fund these communities to reimagine and create climate solutions that can help undo historical harm. And for the public health community, there really needs to be emphasis on listening and learning from these groups, and in fact, finding ways to engage and understand kind of the real unmet needs in these communities as a way to address patterns of disproportionate exposure, to better understand cultural and contextual factors that affect exposure and impact of climate, and to understand that differing patterns of benefit happen across different populations. Next slide. So I'll leave you with just a slide, a glimmer of hope. So while we dub climate change as a risk or threat multiplier, it can also be viewed as a benefit multiplier. I love this quote. Climate change could be the biggest global health threat of the 21st century, but by working together, we can turn it into this century's greatest opportunity for public health. Next slide. For those of you who are interested, here are 2 additional resources to learn more about the human health impacts of climate change. Next slide. And with that, we can either do questions or I can turn it over to Dr. Janice Barnes. Thank you so much.
Thanks, Jen. I think we're running a little bit behind on time, so we can go ahead and turn it over to Janice right now. Thank you.
Thank you. And thanks so much, MUSC, Christine, Rachel, for setting this up. You all have such an important voice in this conversation. I'd like to share, I'll share some things briefly, and the slide decks will obviously be available for you. But maybe just start with the ask. Think about the work that you're doing and think about how you might be able to have conversations with your colleagues, with your neighbors, within your family about the issues on extreme heat. And we'll wrap that back around with some very specific actions at the end of this section. So if you haven't had a look at it, take a look at your city's vulnerability assessment, which raises up not only the flooding, but extreme heat issues as well. This is on the city website. You can easily grab that and download it. Also, as we know, Charleston is struggling so much with flooding. We always say you can't wade through 3 feet of extreme heat. And as a Southern person, I recognize that we sometimes don't think about that, but it is a serious issue. This is a slide adapted from Kirsten Dow that's showing a tripling of extreme heat days in Charleston by the end of the century. So we have to be thinking about this more. And while we look around the campus there and think about all the investments that the medical district is going to make, as well as the others that are your neighbors, the federal as well as private sector, we see a lot of work on water, but there's not so much on heat, albeit the Arboretum is trying really hard, right? So when you think of the conversation that Jen and Chip just raised and the reason Christine has brought us all together here, and you look at what's happening nationally and even internationally, there is an intent to draw greater attention to this topic for the reasons that have already been shared. The NIAS website is a good resource for you if you haven't had a chance to look at that. So what we did last summer to get this conversation going was to do some community science kinds of things. So this, using a FLIR 1, an ArcGIS collector, and a Bad Elf Pro, we did some surface sampling on a typical heat day. So this was a day last August. Those numbers for the temperature, the wind speed, which you know a lot more about now after hearing from Chip, and humidity, that's a pretty normal day. And what we were trying to do is to get a sense of what was happening with surface temperature. We scrubbed that data, reached out to Chip and Kirsten and said, hey, we found these things. What do you think? And what we were beginning to understand was you have these places that the university is encouraging people to be, like the Greenway or otherwise. And sometimes those places actually are what you might consider like a heat harbor or heat island, where you see surface temperatures like these. Obviously, shady is cooler than the unshaded. But what that actually means in terms of exposure is pretty significant. So this is the walk down B Street, and as you know, MUSC, VA, the city with the bike ped, et cetera, there's a lot of money that's going to be put on the street, whether it's through buildings or infrastructure improvements. We want to raise up the heat risk issues so that heat reduction strategies become a part of that. And those surface temperatures are pretty significant. So if you just think about the last time you walked down that street on a hot day, you know what this means, right? When we looked at the backside of the VA, we were looking at this in terms of areas where people are encouraged to gather. And we had heard from some of the VA physicians that patients had passed out on the way to their appointments. I don't know if it's right here, but this is an area where people would wait for the VA shuttle and also obviously come out for refreshments. When we looked at all of that sampling, just like Chip was saying, and that Jen has raised as well, material matters. So when we look at the range of different materials that are across your campus, we were seeing some pretty significant differences in surface temperature. And that's a choice, right? Those are design choices. Like, what are we going to make this thing out of, whether it's a brick paver or an astroturf like Chip was referring to. These choices matter in terms of the human experience. When we look at the peninsula as a whole, we see some pretty doggone hot spaces, and your campus there has a number of those kind of tipping point red areas that you see on the map. So what we said with that surface sampling from last summer and this initial look at the radar data is, if Chip and our colleagues Jen and Maggie, who's on this call, Kirsten and her graduate student Stafford, Jordan, were interested, maybe we could do some research together. In addition, we applied to a third NOAA component for Heat Watch. So what Jen referred to in terms of the human health exposure is going to have an ongoing research study with hydrocons, which are little buttons, and GPS-enabled watches for the MUSC, Citadel, outdoor workers, the groundskeepers, as well as MUSC Public Safety. So that team will be on the ground starting next week. Opportunity to chat with them if you'd like. What Chip just described is the second research here. He and Jordan are in town today setting up, and they'll be doing over the next few weeks. And then the third bit is what's called the Heat Watch research. And there's an opportunity for you to volunteer to be a part of that. And we'll talk about that in just a second. So when we look at Heat Watch, what we were trying to do was to define an area. This is a NOAA program that does driving routes throughout a city to capture heat and humidity. So this is the area of the study. We've got a little bit of North Charleston just because we had some extra capacity in the grant monies. Hopefully next year, North Charleston will be able to go more holistically into the Heat Watch program themselves. This is part of a cohort that's working across the country. Charleston is the first city in the Southeast to really tackle this, so we're super excited about that. You can read more about that on the NOAA website. So what does it actually mean? So we take the city, this is an example from Houston, take the city and work with the researchers that NOAA has engaged, Kappa Strategies, part of the same team that Jen was referring to with Jeremy Hoffman. Divide the city into these polygons. Those polygons then have driving routes where folks will take this gizmo, mount it on their car, drive the route in the morning, drive the route at midday, drive the route in the afternoon, late afternoon, to capture data. That data will then be spatialized so that you get a better sense of what is happening across Charleston as a whole for the very reasons that Jen just described, as well as Chip. And then you can decide as a city, how do you want to deal with this? So for Houston, after they finished their heat watch study, they said, we've got a problem. We want to put a lot more emphasis on tree planting because we have to look at the long view for Houston and how to begin to draw down the extreme heat exposure. So that's underway now. You know, the state is doing some tree planting as well as the Arboretum. So there are many things that you're already doing, but what would happen if Charleston was able to put that same lens of extreme heat awareness onto things like the comp plan or to any of these flooding projects, so that you're not choosing flooding or heat, but you're choosing water and, right? Water and heat together. How do we begin to deal with these things so that every investment that you're making is an investment to improve those conditions? So where we are right now in that process is designing the polygons, the routes that we're going to drive. So we'll have that sorted out this week. And then next week, we'll do a training with the volunteers so that everyone is prepared to conduct this heat research on the 31st. That's a Saturday. Early morning start at Brittlebank Park. It'll be 3 hours of driving, one in the morning, one midday, and one in the afternoon. And the group will then share that data, spatialize that data, and hopefully work with the city and other private investors to use that data to start to cool down Charleston a bit more. So how might you get involved? One is whatever you can do to increase the heat health awareness in the work that you do or in the conversations with your neighbors and with your families so that everyone is much more aware of exposure risk. The second is to think about what you do that could increase coping capacity. So weatherizing your home so that you can shelter in place more easily, working with your patients, if you're physicians, to help them understand the issues that Jen was just raising. What is the current coping capacity within the city? The third is mitigation. So what can we do to avoid making it worse? What can we do to begin to draw down the heat exposure? And then the last thing is adaptation. We've got to have that as well because it's already quite hot and we have to be able to modify the environments in which we work, the environments in which we live, and our own behaviors in order to improve that context. And this is not to say that Charleston's not doing anything. You certainly are. There are a number of initiatives here that are in process or that have recently been completed. And the fact that MUSC has designated July as Heat Month is wonderful. Thank you so much for that. You also have next week your city comp plan. If you have a look at that draft, it has a small component now that recognizes extreme heat. So if you wanted to speak to council, it's 5 o'clock on the 20th. You can register to speak or you can send in written comments and get involved. So those are the options for you. And we're super excited about doing this research in Charleston. And thank you, Christine and team, for inviting us to speak about this today.
Great, thank you so much. All right, we do have about 5 minutes left for some questions. So please put them in the chat or you could raise your hand. I know how to unmute people now. Either of those, if you have any questions. In the meantime, I do have one question that I thought of for Jen. When you said that the lower income communities are up to 7 degrees hotter, I'm wondering why that is. Is it because there's like more pavement, the buildings are closer together?
Yeah, I think there's a number of factors, and Chip was kind of alluding to, and even Janice, around the built environment. But I think one important driver that's an emerging research priority in the climate and health arena is the availability of urban tree canopy. I think that's one motivating factor of many.
Here's one in the chat. So Sean asks, how do we find info about the volunteering?
So Christine had set up a nice little Eventbrite website, so you can use that. You can email me directly if you don't want to use that, Janice at climateadaptationpartners.com, or you can, I can also send you a separate form. So maybe, Christine, you want to put your Eventbrite link into the chat as a starter. We are looking for volunteers. Just a little bit more clarification on that. We're looking for pairs. So a driver and a navigator. You would be assigned one route to do, and we just need your time for that day. Now, just in case the weather doesn't cooperate and we get a rainstorm, we might have to move it. So we're also looking for some backup volunteers. If you can't do the 31st, but you could do the following Saturday, then please let us know.
Great, thank you. Yeah, we do have an Eventbrite for it. I saw that earlier, so we can definitely send that link out.
And I'm putting it in the chat right now.
Perfect.
There we go. All right. And if you can't grab it from there, it's also on the MUSC Go Green Facebook page. Yeah, and we're going to be getting it out in our newsletter and all different places. So thank you.
Yes. And once again, we're MUSC Go Green on all of our social media. So odds are you could find the information that you need on any of those platforms.
Just want to give a big shout out to the work, Christine, that you're doing to raise up this discussion within the MUSC community. It is a big deal. And I just can't encourage everyone enough to kind of follow your lead and getting the word out. And whatever you do, there is a way to make a difference. So thank you, Christine, for modeling that leadership.
Oh, thanks, Janice, and thank you, Jennifer. And I thanked Chip before he left. He's on to doing that heat research right now. So thank you both for coming today, and thank you everyone for being a part of this webinar today. And I do believe we've got something coming out in the Catalyst newspaper for MUSC soon, and possibly look for more information about these topics in the Post and Courier. And just again, we're going to keep trying to get that word out over and over again, and we need everyone's help. We need your help. So if you can pass this presentation on once it's on our YouTube site, if you can pass it on to others, that'd be great.
Awesome. Well,
And thank you, Rachel, for your help.
of course. All right. I think we have hit our time and there are no other questions. So thank you everyone for coming and have a great week.
Thank you all. Really appreciate it.
Thank you.
Thank you. Bye-bye.